Hi and welcome viewers of Nursing Academy 101. In this video, we will talk about latest pharmacology related multiple choice questions for nurses along with the answers and rationales. Part 2. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question number 1. A teenage patient is admitted to the hospital due to an overdose of acetaminophen Tylenol. Overdoses of acetaminophen can lead to life-threatening abnormalities in which of the following organs? A. Lungs, B. Liver, C. Kidneys, D. Adrenal glands. The answer is B. Liver. Acetaminophen is extensively metabolized in the liver. Toxic doses of acetaminophen can deplete hepatic glutathione, leading to the accumulation of a toxic intermediate, which can cause hepatic necrosis. While prolonged use of acetaminophen may increase the risk of renal dysfunction, a single overdose doesn't typically precipitate life-threatening problems in the respiratory system, renal system, and adrenal gland. Question number 2. When using topical corticosteroids to treat atopic dermatitis, eczema, a contraindication for usage in a patient is A. Parasite infection, B. Viral infection, C. Bacterial infection, D. Spirochete infection. The answer is B. Viral infection. When treating atopic dermatitis with topical corticosteroids, the site is vulnerable to invasion by organisms. Viral infections such as herpes simplex or varicella zoster present a risk of disseminated infection. Patients using topical corticosteroids should be educated to avoid crowds or people known to have infection and to report even minor signs of infection. Topical corticosteroids usage doesn't typically pose a significant risk of concurrent infection with parasites, bacteria, or spirochetes. Question number 3. In infants and children, the side effects of first-generation over-the-counter OTC antihistamines such as diphenhydramine spinadrine and hydroxyzine atarax include A. Ray's syndrome, B. cholinergic effect, C. paradoxical CNS stimulation, D. nausea and diarrhea. The answer is C. Paradoxical CNS stimulation. First-generation OTC antihistamines typically have a sedating effect due to their ability to pass into the CNS. However, in some infants and children, paradoxical CNS stimulation may occur, leading to symptoms such as excitement, euphoria, restlessness, and confusion. This is why the use of first-generation OTC antihistamines has decreased and second-generation products are now more commonly used. Ray's syndrome is a systemic response to a virus and is not directly associated with the use of first-generation antihistamines. They don't typically exhibit cholinergic effect, and nausea and diarrhea are uncommon side effects. Question number 4. Ray's syndrome, a potentially fatal illness associated with liver failure and encephalopathy, is associated with the administration of which over-the-counter medication? A. Acetaminophen, Tylenol, B. Ibuprofen, Motrin, C. Aspirin, D. Brompheniramine, pseudoephedrine, dimetap. The answer is C. Aspirin. Ray's syndrome is associated with the use of aspirin, acetylsalicylic acid, in virus-infected children. Children who are given aspirin for pain, fever, and inflammation are at an increased risk of developing Ray's syndrome. Acetaminophen doesn't have a direct association with Ray's syndrome and can be safely given to patients with fever due to viral illnesses. Ibuprofen may cause adverse effects such as gastrointestinal irritation and bleeding, but it is not being associated with Ray's syndrome. Brompheniramine pseudoephedrine contains a first-generation OTC antihistamine and a decongestant, neither of which has been associated with Ray's syndrome. Question number 5. Patients who are allergic to intravenous contrast media are usually also allergic to which of the following products? A. Eggs. B. Shellfish. C. Soy. D. Acidic fruits. The answer is B. Shellfish. Some types of contrast media used for intravenous imaging contains iodine as an ingredient. Shellfish also contain significant amounts of iodine. Therefore, patients who are allergic to iodine may exhibit an allergic response to both iodine-containing contrast media and shellfish. Eggs, soy, and acidic fruits don't contain iodine. Question number 6. A 14-month-old child who recently arrived in the United States from a foreign country with his parents needs childhood immunization. His mother reports that he is allergic to egg and has a history of anaphylaxis. Which of the following vaccines should he not receive? A. Hepatitis B. B. Inactivated polio. C. Diphtheria, pertussis, tetanus, DTP. D. Mumps, measles, rubella, MMR. The answer is D. Mumps, measles, rubella, MMR. The measles portion of the MMR vaccine is grown in chick embryo cells, while the current MMR vaccine doesn't contain a significant amount of egg protein. Children with a history of anaphylaxis to eggs should receive the MMR vaccine in a medically controlled setting where full resuscitation efforts can be administered if anaphylaxis occurs. The hepatitis B, inactivated polio, and DTP vaccines don't contain egg protein and can be safely administered. Question number 7. The Gel and Combs classification system is a useful tool for categorizing allergic reaction and describing patient reactions to drugs. Type 1 reactions, which are immediately hypersensitivity reactions, are mediated by A. Immunoglobulin E, B. Immunoglobulin G, C. Immunoglobulin A, D. Immunoglobulin M. The answer is A. Immunoglobulin E, IgE. Type 1 allergic reaction involves the mediation of immunoglobulin E. Immunoglobulin E binds tightly to receptors on basophils and mast cells, playing a crucial role in allergic reactions. When an allergen binds to IgE on these cells, it triggers the release of various pharmacological mediators, leading to allergic symptoms. While IgG is the major immunoglobulin in the serum, IgE is specifically involved in immediate hypersensitivity reaction. Question number 8. Drugs can cause adverse events in patients, and bone marrow toxicity is one of the most common types of drug-induced toxicity. The most severe form of bone marrow toxicity is A. Aplastic anemia, B. Thrombocytosis, C. Leukocytosis, D. Granulocytosis. The answer is A. Aplastic anemia. Aplastic anemia is a severe form of bone marrow toxicity resulting from a hypersensitive reaction, and it is often irreversible. It leads to pancytopenia, which is a significant decrease in all types of blood cells, including red blood cells, white blood cells, and platelets. Aplastic anemia causes a reduction in red blood cells, making hemoglobin level drops, a decrease in white cells, making the patient susceptible to infection, and a decrease in platelets leading to difficulty in blood clotting. Treatment for mild cases involves supportive care, while severe cases may require a bone marrow transplant. Option 2, 3, and 4 are all related to elevated cell counts, which are not indicative of the most serious form of bone marrow toxicity. Question number 9. Serious adverse effects of oral contraceptives include A. Increase in skin oil followed by acne. B. Headache and dizziness. C. Early or mid-cycle bleeding. D. Thromboembolic complication. The answer is D. Thromboembolic complication. Oral contraceptives have been associated with an increased risk of serious adverse effects such as stroke, myocardial infarction, and deep vein thrombosis. These risks are higher in women who smoke. An increase in skin oil followed by acne is an effect of progestin excess, while headache and dizziness are effects of estrogen excess. Early or mid-cycle bleeding is an effect of estrogen deficiency. Question number 10. The most serious adverse effects of allopurinol prostatin VR pediatric injection administration in unit is A. Apnea, B. Bleeding tendencies, C. Hypotension, D. Pyrexia. The answer is A. Apnea. While all the listed options are potential adverse reaction of allopurinol administration, the most serious one is apnea, which can occur within the first hour of a drug infusion, particularly in neonates with congenital heart defect. Clinicians using allopurinol must be prepared to intubate and mechanically ventilate the infant if apnea occurs. Close monitoring for apnea or respiratory depression is essential, and in some cases, elective intubation may be performed prior to initiating the medication. Question number 11. Your patient contacts the clinic today reporting pain in both legs while taking atorvastatin Lipitor for high cholesterol. You advise him to A. Discontinue the medication and schedule an appointment for next week. B. Continue taking the medication and schedule an appointment for next week. C. Stop taking the medication and visit the clinic today. D. Engage in at least 30 minutes of walking and inform you if symptoms persist. The answer is C. Stop taking the medication and come to the clinic to be seen today. Muscle ache, soreness, and weakness can be early signs of myopathy, including rhabdomyolysis associated with the use of HMG-CoA reductase inhibitors like atorvastatin. It is essential to evaluate the patient immediately to rule out myopathy, as continuing the medication or delaying evaluation can worsen the condition. Exercise will not reverse myopathy, and delaying diagnosis may lead to complications. Question number 12. Which of the following adverse effects is linked to levothyroxine synthroid therapy? A. Tachycardia, B. Bradycardia, C. Hypotension, D. Constipation. The answer is A. Tachycardia. Levothyroxine can induce hyperthyroid-like syndrome, including tachycardia, especially at higher doses. It doesn't typically cause bradycardia. Hypotension would be a side effect of bradycardia, not levothyroxine. Constipation is a symptom of hypothyroidism, not an adverse effect of levothyroxine. Question number 13. Which of the following adverse effects is specific to metformin glucophage therapy, ubiquinate diabetic drug? A. Hypoglycemia, B. GI distress, C. Lactic acidosis, D. Somnolence. The answer is C. Lactic acidosis. Lactic acidosis is the most dangerous adverse effect associated with metformin administration. Also, it's relatively rare. Metformin doesn't induce hypoglycemia but can cause some gastrointestinal distress like nausea, vomiting, and diarrhea. Somnolence is not a specific adverse effect of metformin. Question number 14. The most severe adverse effect of a tricyclic antidepressant TCA overdose is A. Seizure, B. Hyperpyrexia, C. Metabolic acidosis, D. Cardiac arrhythmia. The answer is D. Cardiac arrhythmias. Excessive ingestion of TCAs can lead to life-threatening wide QRS complex tachycardia, which is a serious cardiac arrhythmia. While seizures can occur, they are generally not life-threatening. TCAs do not cause hyperpyrexia or metabolic acidosis. Question number 15. Which solution is commonly used to flush an IV device before and after blood transfusion? A. 0.9% sodium chloride, B. 5% dextrose in water solution, C. Sterile water, D. heparin sodium. The answer is A. 0.9% sodium chloride. 0.9% sodium chloride, also known as normal saline, is routinely used to flush IV devices before and after blood transfusion. It has the same osmolarity as blood and helps prevent red cell lysis. The other options are not suitable for this purpose. Question number 16. When administering blood products, which component always requires cross-matching? A. Packed RBCs, B. Platelet, C. Plasma, D. Granulocytes. The answer is A. Packed red blood cells. Cross-matching is necessary for packed red blood cells because they contain antigens and antibodies that must be matched between the donor and recipient. Platelets, plasma, and granulocytes don't contain red blood cells and therefore do not require cross-matching. Question number 17. A month after a blood transfusion, an immunocompromised patient develops fever, liver abnormalities, a rash, and diarrhea. The nurse suspects A. Nothing related to the blood transfusion. B. Graft versus host diseases (GVHD). C. Myelosuppression. D. An allergic response to a recent medications. The answer is B. Graft versus host disease (GVHD). The symptoms described are consistent with the graft versus host disease (GVHD), which occurs when the white blood cells in the donor blood attack the tissues of an immunocompromised recipient. GVHD can develop within a month of transfusion in immunocompromised individuals. The other options are not the most likely cause in this scenario. Question number 18. A client visits the local blood donation center to donate platelets. This process is called A. Directed donation, B. Autologous donation, C. Allogenic donation, D. Apheresis. The answer is D. Apheresis. Apheresis is the process of collecting whole blood from a donor, separating its components, withdrawing a specific portion such as platelets, and transfusing the remaining component back to the donor. Directed donation involves collecting blood from a non-donor other than the recipient, while autologous donation involves collecting and re-infusing the patient's own blood. Allogenic donation refers to collecting blood from a donor other than the recipient. Question number 19. The age group that utilizes the most units of blood and blood product is A. Premature infant, B. Children age 1 to 20 years, C. Adults age 21 till 64 years, D. The elderly above age 65 years. The answer is D. The elderly above age 65 years. Individuals above the age of 65 years utilize the highest percentage, 43% of donated blood. This demand is expected to increase as the population ages. Question number 20. A child admitted with a serious infection becomes severely neutropenic after 2 days of antibiotics. The physician ordered granulocyte transfusions for the next 4 days. The mother asks the nurse why. The nurse responds, A. This is the only treatment left to offer the child. B. This therapy is fast and reliable in treating infections in children. C. The physician will have to explain his rationale to you. D. Granulocyte transfusions replenish the low white blood cells until the body can produce its own. The answer is D. Granulocyte transfusions replenish the low white blood cells until the body can produce its own. Granulocyte neutrophil transfusions are administered to replenish the low white blood cells count in a severely neutropenic patient until the body can produce an adequate number of white blood cells to fight the infection. Option A, B, and C don't provide accurate information regarding the purpose of granulocyte transfusions. Question number 21. A neighbor expresses reluctance to receive blood products transfusions due to a fear of contracting an infection before undergoing surgery. The nurse teaches the person that the safest blood product is A. An allogenic product, B. A directed donation product, C. An autologous product, D. A cross-match product. The answer is C. An autologous product. The safest blood product recommended by the American Medical Association Council on Scientific Affairs is an autologous product. Autologous donation involves collecting and reinfusing the patient's own blood, eliminating the risk of recipient incompatibility and infection. Allogenic products are collected from a donor other than the recipient, while directed donation products are collected from a non-donor, usually a family member or friend. Cross-matching enhances compatibility but doesn't detect infection. Question number 22. To prevent graft versus host disease (GVHD) in a severely immunocompromised patient receiving a blood transfusion, the physician orders A. Diphenhydramine hydrochloride Benadryl. B. The transfusion to be administered slowly over several hours. C. Irradiation of the donor blood. D. Acetaminophen Tylenol. The answer is C. Irradiation of the donor blood. To prevent graft versus host disease (GVHD) in a severely immunocompromised patient, the donor blood must be irradiated to eliminate white blood cell functioning. Diphenhydramine hydrochloride is an antihistamine used to decrease the likelihood of a transfusion reaction, but it doesn't prevent GVHD. Administering the transfusion slowly or using acetaminophen treats the common side effects of blood administration but doesn't prevent GVHD. Question number 23. A patient who is about to receive a blood transfusion asks the nurse about the most common types of infection that could be contracted from the transfusion. The nurse tells the patient that approximately 1 in 250,000 patients contract A. Human immunodeficiency disease (HIV), B. Hepatitis C infection, C. Hepatitis B infection, D. West Nile virus disease. The answer is C. Hepatitis B infection. Hepatitis B infection is the most common infection spread via blood transfusion. Also, the risk has significantly decreased due to donor questioning and blood testing. The risk of contracting HIV or hepatitis C from a blood transfusion has decreased to approximately 1 in 2 million. The incidence of West Nile virus disease transmission is relatively rare and not well established. Question number 24. A patient with blood type AB, rhesus factor positive, require a blood transfusion. The transfusion service blood bank sent type O rhesus factor negative blood for the nurse to infuse into this patient. The nurse knows that A. This donor blood is incompatible with the patient's blood. B. Premedicating the patient with diphenhydramine hydrochloride Benadryl and acetaminophen Tylenol will prevent any transfusion reaction or side effect. C. This is a compatible match. D. The patient is at minimal risk receiving this product since it is the first time he has been transfused with type O rhesus negative blood. The answer is C. This is a compatible match. Type O rhesus factor negative blood is considered a compatible match for a patient with a blood type AB rhesus factor positive. Type O blood is known as the universal donor because it lacks the major antigen present on A and B blood types. Premedicating with diphenhydramine hydrochloride and acetaminophen will not prevent a major transfusion reaction if the blood types and rhesus factors are incompatible. Question number 25. In order for transfusion services in the blood bank to prepare the correct product, a sample of the patient's blood must be obtained for A. A complete blood count and differential. B. A blood types and cross-match. C. A blood culture and sensitivity. D. A blood types and antibody screen. The answer is B. A blood type and cross-match. Obtaining a blood sample for a blood types and cross-match is necessary to ensure compatibility between the donor blood and the patient. Incompatible matches can lead to severe adverse events and potential death. Option A and C are unnecessary tests in this context, and option D doesn't determine donor blood compatibility. Question number 26. When a patient needs to receive a unit of whole blood, the nurse should consider starting what type of intravenous IV device? A. A small catheter to decrease patient discomfort. B. The type of IV device the patient has had in the past, which worked well. C. A large bore catheter. D. The type of device the physician prefers. The answer is C. A large bore catheter. Starting a large bore catheter is recommended when a patient needs to receive a unit of whole blood. Large bore catheters prevent damage to blood components and are less likely to develop clotting problem compared to small bore catheter. The nurse should make the decision based on best practice and not rely on the patient's past IV device or the physician preference. Question number 27. The physician orders a gram of human salt pure albumin products for a patient. The product is available in a 50 milliliter vial with a concentration of 25%. What dosage will the nurse administer? A. The nurse should use the entire 50 milliliter vial. B. The nurse should determine the volume to administer from the physician. C. This concentration of product should not be used. D. The nurse will administer 4 milliliter. The answer is D. The nurse will administer 4 milliliter. A 25% concentration of a human salt pure albumin products contain 1/4 of a gram per milliliter. To administer a complete gram of albumin, the nurse should administer 4 milliliter. The concentration is 4 milliliter times 0.25 gram per ml equal 1 gram. Using the entire 50 milliliter vial would result in administering 12.5 grams of albumin, which is incorrect. The nurse should calculate the volume based on the concentration and dosage requirements. Question number 28. Central venous access devices, CVADs, are frequently utilized to administer chemotherapy. What is a distinct advantage of using the CVAD for chemotherapeutic agent administration? A. CVADs are less expensive than a peripheral IV. B. Once a week administration is possible. C. Caustic agents in small veins can be avoided. D. The patient or their family can administer the drug at home. The answer is C. Caustic agents in small veins can be avoided. One distinct advantage of using central venous catheter device (CVAD) for chemotherapeutic agents administration is that caustic agents, which can cause tissue damage, can be avoided in small veins. CVADs allow for the administration of vesicant drugs into larger veins, reducing the risk of tissue necrosis. Option A, B, and D do not accurately describe advantage of using CVADs for chemotherapy. Question number 29. If an infection in a central venous access device is not eliminated by giving antibiotics through the catheter, how would bacterial glycocyclics contribute to this? A. It protects the bacteria from antibiotics and immunological destruction. B. Glycocyclics neutralize the antibiotics, rendering it ineffective. C. It competes with the antibiotics for binding sites on the microbe. D. Glycocylics provides nutrients for microbial growth. The answer is A. It protects the bacteria from antibiotics and immunological destruction. Bacterial glycocylics, a slimy layer covering microbes, protects the bacteria from antibiotics and immunological destruction. It enhances adherence to services, resistant phagocytic engulfments by white blood cells, and prevents antibiotics from contacting the microbes. Glycocylics doesn't neutralize antibiotics, compete for binding sites, or provide nutrients for microbial growth.